33-story hotel and condo project.
I'd probably be
Okay,
like
like
that.
stop, tap.
This is a plan by the community for the community.
This one here, showing me.
No problem, Ken. Thanks for having me.
It's Kent Mulgat for KelownaNow. And we're joined by Dr. Silvina Mema, a medical health officer with Interior Health. Thanks for coming in
Thanks for having me.
to talk about what I would say is an emergency, an ongoing emergency. Would you agree?
Yes, this is a public health emergency that was declared in 2016, and we are still in under the public health emergency.
Yeah, it's tough to sort of maintain yourself in an emergency situation, but I guess what it tells you and people at Interior Health is to just not stop, keep looking for new answers and keep working on it.
Yeah, yes. So since the emergency was declared in 2016, Interior Health and the province has been working on a number of initiatives like the take-home naloxone, the kits, giving out those kits, expanding treatment options for people. And as you say, it's hard to keep the momentum going because an emergency after 2 years and a half begins to fade. So how do we keep that momentum going? And that we get a lot of provincial direction. The province has, as you know, developed a new ministry, and there is new direction that is coming down from there with innovations and ideas that we can implement and try and curb this overdose emergency.
Right. Now, we heard tragic numbers out of Kelowna in particular in 2017. Some, 75
Yes.
drug-related overdose deaths,
Yes.
leading pretty much any community in BC.
Yes. Yes, in 2017, 79 people died in Kelowna alone, and that compares to 19 people died 2 years before that. So that is a tragedy. It's a lot of lives that are being lost in this community. And if you think about the size of this community, it's a lot of families that are impacted, friends, providers. These are Interior Health staff that provide care to these patients, and then they die, and that is very damaging for people. So it's not just the deaths, which are a tragedy, but also all of the impact that has on families and other neighbors and friends.
Right, so I know that your people are all working on it. Do you have any encouraging news about those numbers? It's for anything from 2018?
Yeah, 2018, it's very preliminary. However, since January to May, we are seeing a slight decline in the number of people that are dying. However, we don't get too excited about that because we've seen variation month to month, and we got excited sometimes, and then the next month was a tragedy again. So I want to be very careful in being optimistic about the number of deaths coming down. However, if there is anything to share that is good news, is that there is a lot of services now available, a lot more services available in Kelowna for people who have a substance use disorder. So anyone who is struggling with addiction, with mental health, now has more inputs into the system. The Doyle building, 505 Doyle Avenue, anyone can go on the second floor and ask to speak to a mental health worker, and there they will see there is options. If they need treatment, if they need a group therapy, if they need what they call intensive care management, those options are at Doyle. Someone going with an overdose to the Kelowna General Hospital, there is workers now in the emergency department that will connect with that person if they had an overdose and connect them with services.
Right.
And the last service that we have now implemented is overdose prevention nurses. So there is nurses, outreach nurses outside on the streets that are going to connect with people who need services. And all of that to try and draw them to the treatment or the care that they may benefit from that Interior Health can provide.
One interesting thing you mentioned before this interview was that when you're talking about outreach, one of the areas where you noticed a large number of those deaths occurring were typically men using drugs at home all alone. And if something goes wrong, there's no one there.
Yes.
So I take it you've been actually just trying to find out who are the people that are using in this way and reach out to them?
Yes. We have launched a campaign 2 months ago, a campaign that was called Use Safe, and that campaign tried to reach exactly that population, the people who use alone. people who are using in a shelter or in a mobile supervised consumption, those are not dying, because if they overdose, there is people around them that can provide naloxone or call 911. However, if you are alone in your home or in a bathroom, in a public place, then nobody will rescue you, and your chances of dying are significantly higher. So we launched a campaign to ask these people who use alone, what is that you need? What can we provide you that to keep you safe? And the number one answer we got is that people are doing that because of stigma, because of shame. So
Right.
that's what draws them to be alone and not reach out for help.
And also when you talk about accessing services, I understand that in Kelowna in particular, you can put all these services out there for people, but there isn't the uptake that you get even in a city like Kamloops for whatever reason. Have you been able to figure out why it is that in particular people aren't accessing services?
Well, there is a demand for services. For a while, we had more demand that we could cater for.
Right.
So there was a waiting list and such, and that was something that we worked very hard and still working on to try to have a same-day access to treatment. So there was demand. For harm reduction services, harm reduction is those services that are provided to people who are still using and not ready to quit.
Right.
Because there is a readiness process, and
Yes.
this is not a choice. This is not something that for people who have a substance use disorder, is not that they wake up and they say, oh, today I'm choosing to do this. It's something that they have to do because they have an addiction, and that's a disease. For those people who are not ready yet to quit or go on treatment, we provide harm reduction services, and that is the naloxone kit, the needle exchange program, and that's an opportunity to engage with them and
Right.
have a conversation. And you're right, the demand is not as high, obviously, as in the downtown east side, where the population of people who
Right.
use is significantly larger than here. But still, we are seeing an increase in the demand of
Right.
harm reduction services and also over mental health services.
But the behavior patterns seem to suggest that in Kelowna in particular, people are governed by stigma concerns.
Well, this is a smaller community. In Vancouver, they've had this problem for many years. It's not the first time. Actually, an emergency was declared in the 90s in the downtown east side because people were dying, right? So they've had this before, and they have a lot of services there. And if you think about the community there is more open to talking about harm reduction services and that it's more normalized in that community. Smaller communities like Kelowna are seeing the homeless population, the people who use drug grow because the city is also growing, and then these conversations are starting. It's
Right.
new. It's not a supervised consumption here is something new. In the downtown east side, that safe consumption place has been there for over a decade.
This is a tough trick for people to do, though, to understand what a serious emergency these drugs present, but yet at the same time to accept it as normal and to not stigmatize it. That requires a little bit of mental gymnastics.
Yes. What's normal, it's not, I wouldn't want people to get the impression that it's normal to use drugs or it's normal to die of an overdose. We don't want to get used to that. But what should be normal is having a conversation about mental health and addiction. Someone who has an addiction problem should be able to seek help in a safe environment without fear of being fired or being stigmatized for their drug use. That's the shame is what is the biggest barrier between, is that wall that puts people alone and has them dying alone because they cannot reach out for help. If you think about any other disease, if you had a fever and you were ashamed of having a fever and you wouldn't go to the hospital because you have a fever, you would never be cured from your pneumonia or whatever, and some of them would die. This is very similar. You have a symptom, you have an addiction, and you cannot find help because you're ashamed of that addiction, of that disease.
So, are you seeing any progress? Are we breaking down those
Oh,
barriers?
absolutely. We are having conversations. Now we have a community action team in Kelowna, which is a fantastic idea, and that's something that comes from the Ministry of Mental Health and Addiction. It's have community conversations. This is beyond what the Interior Health can do. This is not the doctors and the nurses. This is the community, in order to remove some of that stigma, some of that shame, and to talk to the families and to reach those who are having struggles. The conversation needs to stay in the community, and that's exactly what we are doing. We have a community action team. We are planning events to decrease stigma and shame, and to normalize the conversation about mental health.
Right. So are there any things that people who might be watching this and they
Yes.
feel moved or motivated?
Yeah.
What can people do to make sure that they're part of the solution and not part of the problem?
Yeah, so anybody who is watching this and has an addiction problem, go to Doyle, 505 Doyle Avenue, go to the second floor, ask a friend to go with you, and when you're there, ask to speak to a mental health person and see what options there are for you. If you're a person that uses drugs alone, make sure you have a take-home naloxone kit and you have someone. Talk to someone and let them know when you're using. That's called a buddy system. So if you have a friend, reach out, don't be alone using, because that's what increases the chances of dying. And then for family members, or friends, don't be scared to start the conversation. There needs to be a conversation when reach out to those that you feel are at risk.
Sounds like some good advice. Thanks for coming in.
Okay, thank you for having me.
Dr. Silvina
Thanks.
Mema from Interior Health, and you're watching Kelowna Now.